can't find the third one on that.
It may have to do with the level at which it's cut.
Okay.
But you can clearly see it here. So if it's cut here, you're only going to see maybe 2.
Okay.
If they cut it here, you'll see 3.
Now, if you were going to ask us to identify them on a test, are you going to use this? You'll use this one. Okay.
Just like this. So starting from the external nares here, I would work my way back. External nair to the vestibule, which is this depression here. It opens up into the nasal cavity. And then you have superior, middle, inferior nasal concha, and the meatuses, the depressions between them.
Okay.
Behind them, you have the internal nares here, opening to the eustachian tube. You have the pharyngeal tonsil here, palatine tonsil here, lingual tonsil here, hard plate, uvula.
Uvula. Soft palate, another name for that, or the same name?
Right, this is the soft palate, soft
But
muscle.
uvula is another word for that?
Oh, what do I have on there?
It's just soft palate.
Soft palate, that's it.
Okay.
But that's the uvula. When you're looking in the mirror, that's what you see.
Okay.
Then we have nasopharynx. This region back here in the back of the throat is the nasopharynx. So you find the nose, you come all the way back, nasopharynx.
Okay.
This region is the oropharynx. Find the opening to the mouth, come all the way back, oropharynx. This is the laryngo or hypopharynx. So you find the larynx, that's the region of the back of the throat here. Nasopharynx, oropharynx, laryngopharynx. And then it leads either to the esophagus or this is the epiglottis, this is the rhemoglottis, the opening. This white ridge here represents the true vocal cords. These are the vestibular folds here, okay? And this is the false vocal cord, and this is the trachea. So from here up, the questions I would ask are external, or I could ask, external nares, vestibule, nasal cavity, concha, superior, middle, and inferior, meatuses, internal nares, eustachian, pharyngeal tonsil, palatine tonsil, lingual tonsil, nasopharynx, oropharynx, laryngopharynx. From there, I would go to this model, where I could ask hyoid bone, thyroid cartilage, cricoid cartilage, tracheal cartilages, then ligaments and membrane, thyrohyo-median ligament, thyrohyoid membrane. These are on oblique angle. Then we have the cricothyroid ligament, cricothyroid membrane, cricotracheal ligament, and these are all tracheal ligaments, and these are all tracheal cartilages. And that's what I would ask there.
Question on that. Cricothyroid muscle? Is that
Here.
this right here? Okay.
Epiglottis, if I didn't mention it. Now, these are the arytenoids, and this is the caniculate. This is the only one, or one of two, that actually has them. It's unlikely that I would ask it if I don't have a model with it. Then I would go to this model, where I would start with the trachea, carina, where they split to form the left primary bronchus, secondary bronchus, tertiary bronchus. Inside here where the heart would sit, this is the mediastinal surface. However, this depression is the cardiac notch. This hilus is where the blood vessels enter, pulmonary veins, pulmonary arteries, and on the opposite side as well. Then we have the costal or visceral layer. We have the apex, the pointed tops, and the base, the flat part, and the diaphragm. No, I don't have that model. I have the model out back there, but I don't have it over here. I won't be using it.
One last question. You have vestibule here under the ventricular folds, and you also have it up here. Are they two different areas?
It's just indicating that it's the area just preceding the structure. Okay. In this case, it's the vestibule preceding the cavity. In this case, the vestibule preceding the true vocal cords.
Okay. But are you going to ask us maybe if this is called the vestibule?
No, probably not.
Okay. And these are the false vocal cords right here, these
Yes.
top ones? Okay. That's the only one we couldn't find. Good.